Good afternoon, and thank you for joining us today for this Business Planning Forum. I'm Karen Riordan, President and CEO of the Myrtle Beach Area Chamber of Commerce and CBD. COVID-19 is at the top of everyone's mind this week. This is a rapidly evolving situation around the world, in our state, and even locally, with 3 cases identified here in Horry County as of yesterday. We know as business owners and operators, this situation has created specific challenges for you, and we put together this forum to help you manage your business during these very uncertain times. Before we get started, I would like to introduce our panelists today. Today, we have with us Wendy McCrackin, Executive Director of Human Resources for HTC, Dr. Philip Dulberger, EVP and Chief Physician Executive for Tidelands Health, and Mark Kruea, Public Information Director for the City of Myrtle Beach. Wendy McCrackin is the Executive Director of Human Resources for HTC. She is a graduate of the University of Maryland and holds a BA in English and Secondary Education and earned her SHRM SCP in 2015. She has worked for HTC for the past 13 years. Today, she is going to talk with us about human resource policies and procedures that you should consider implementing related to COVID-19. Dr. Philip Dulberger is the Executive Vice President and Chief Physician Executive of Tidelands Health. He joined the organization in 2013 and is responsible for the delivery of clinical care across the health system. A board-certified anesthesiologist, Dr. Dulberger earned his medical degree from Indiana University School of Medicine. He completed his internship at Methodist Hospital of Indiana and his anesthesia residency at Duke University Medical Center. Dr. Dulberger is going to share some preventive health recommendations for businesses. And Mark Kruea is Public Information Director for the City of Myrtle Beach. He joined the city's Public Information Department in 1998. Mark is a native of Salisbury, North Carolina, and a 1980 graduate of Wake Forest University with a BA in English. Today, he will provide a City of Myrtle Beach preparedness update. And now we'd like to begin, and we're going to start first with Wendy McCrackin.
Thank you very much for allowing me to be here. And first of all, we say that we are very sorry that our community is experiencing this, and we understand that the impact on businesses has been tremendous already and will continue to be so. I will have a disclaimer as a starter. This is unprecedented, and I am not an expert in navigating through these times. So I'm here basically to share from a human resources and corporate perspective what we've done thus far and what we are talking about doing for the future. We are all getting through this together for the first time. I understand that today's business audience will range from small business owners to companies like HTC with 600 or more employees, and the needs of those businesses will be different. So some of what I speak about may be pertinent to one sector, and some may be pertinent to a different. So please be patient with me as we get through all the information. So just from an HR perspective, to begin with, we consider what are the objectives of what we're trying to do. And an HR partner wants to make sure that we're meeting our business objectives. We want to continue to help the business run. We also want to protect and provide help to our customers, community, and our employees. And we want to remain in legal compliance for the company and make sure that everything that we're doing will test discrimination testing and make sure that it is up to date with the laws that we're seeing changed even right now, such as the Family First Act. So when we think about our employee needs, we have tried at HTC to communicate and provide information as frequently as possible. We understand that with more information that we give our workforce, the more ease they're going to experience. There is a lot of fear and a lot of panic right now because of all of the media attention to this. We see closures happening around us, schools are closing, and our employees are left to just make an understanding of this on their own. So we are putting out company communications almost on a daily basis right now, which is balancing factual information along with a sensitivity to the challenges that they are facing. We're also providing flexibility with the announcement of schools closing, we understand that we have people that have two parents working or single parents in the home, and they may need some flexibility. So last night we sent a company-wide text message just letting them know we heard the school closure message and that we would work with anyone that had scheduling challenges today and into the week. In addition, they want to know that they are protected. Our employees need to be protected, and with that we look at a couple of different things. So from our perspective, we started with just getting educated. So when we look at the coronavirus, there was a lot of unknowns to begin with, still are, but we became educated and understood that the first technique that we all need to implement is prevention. How do we do that? So we became very familiar with, just as everyone else has heard, washing hands. We posted posters in all of the bathrooms that just gave instructions on how to wash your hands properly, and broke it down to the 20 seconds and warm water and singing happy birthday 3 times, and just tried to get it out into their realm a good bit. We also are trying to suspend any policies that may feel punitive in nature. So if, as an organization, we take attendance, and if someone violates those attendance practices, but yet right now they need more flexibility, those two don't go hand in hand. So we have tried to adjust our attendance policies to make sure our employees know that the flexibility is there. We're suspending anything that would not be in compliance with that. We are asking our employees, we've sent out some communication with just 7 responsibilities that they have. One at the top of the list is stay home if you are sick, and really marketing that more than anything, and defining what is sick. So we are defining, if you have a fever, do not come to work. If it's 100.4, do not come to work for your own sake and for the sake of those around you. We also understand that if someone is coughing, that we have to look at that in addition to other criteria, because pollen season is currently going on, and you can look at a car and see right now that people are going to have allergies as well. So we have to use some judgment in making those determinations and helping employees come to those determinations. We have asked our employees to report possible virus exposure. So if they have someone in their home, or they have been around someone, or they've traveled somewhere that has a high risk, to self-disclose that. We've also asked them to self-disclose any upcoming travel plans. We've emphasized hygiene. We have asked them to avoid gatherings and unnecessary touching. We are utilizing technology and asking people, instead of a meeting, to host a conference call. In Human Resources, we have interviews scheduled this week, and we have asked our people interviewing to move those to Skype interviews. So not stop business, but get creative using technology in ways to continue business. We are asking all of our employees to clean their own workstations and to own making sure that they come behind anyone. If a customer comes in and coughs on the counter, own that and clean everything around them. So first at the list was to try and find cleaning supplies to distribute across our company, and that was difficult last week. So we are buying in bulk and buying spray cans and doing what we can to be able to provide those materials to our employees. Along with a lot of others, we're limiting corporate travel and limiting vendor access to our company as well. So those are ways that we are actually trying to secure our workplace and prevent the spread, because the flatten the bell curve seems to be the theme, and how can we prevent the spread of this disease within our organization and slow it down so that we don't overload our health agencies. Those are the things that we are doing. We are looking at remote workstations and identifying those in our company that are set up to do that, and even the roles and responsibilities of people within the company, and can they do that. If you are a company like ours, we provide an essential service to the community, and it requires customer face-to-face interaction to a degree. So many of you tuned in, I'm sure, have people that need to come into your business place in order to conduct that business. So how do you minimize? We are looking at containment protocol right now as well, and this is where We're not completely there yet, but we're looking at what happens when we have a first positive case, or what happens when someone has someone at home that they're caring for that is positive. And to that end, we are basically marketing the healthcare professionals in the area that are taking phone calls, like Conway Medical Center, Tidelands, DHAG, MUSC has an online virtual care provider. So we're advertising those phone numbers so that employees have somewhere to call and they know where to go. So those are the things that we're doing inside of the company right now. Our executive staff is on a conference call right now trying to figure out what the next steps will be and communicate that to our workforce. In addition to all of that protocol, we are looking at legal issues right now, and there are several legal issues that we need to consider from an employment perspective on how we treat people. So in the workplace, there are questions surfacing like, if I suspect that someone is exhibiting symptoms but doesn't want to go home, can I force them to go home? Can I force them to utilize PTO? Or is that a legal means of conducting business? And the answer to that is yes. And it is not protected by the ADA because the definition tells us that anyone who poses a hazard, we have the ability to be able to send them home. Something hot right now for many who are already losing jobs, any workforce that is being cut back. We know that the Families First Coronavirus Response Act was passed by the House on Saturday. And for those of you who are not familiar with that, it pertains to employers with fewer than 500 employees. We're not really sure why it was drafted that way. There might be something forthcoming for employers with more than 500, but right now they wanted to address the immediate needs of the smaller businesses. So the Paid Family Medical Leave Act is included in this that provides 12 weeks of job-protected paid family medical leave. 14 days can be unpaid, but then employers with fewer than 500 employees would have that act available to them. The biggest thing that people are looking for is the unemployment bill supplement. So the bill provides for $1 billion in emergency unemployment insurance relief to states, $500 million for costs associated with increased administration of each state's uninsured program, and $500 million held in reserve to assist states with a 10% increase in unemployment. So besides the necessary increase in unemployment, in order to receive a portion of this grant money, states must temporarily relax certain unemployment eligibility requirements. Those requirements typically are a person is discharged to no fault of their own, and they are available to work immediately, and there is a 1 week waiting period. So this bill is waiving the waiting period. It was passed in the Senate Saturday. There were errors in it. Everybody is scrambling to get this information together. There were some errors in it. It's going back in front of the House to be passed, and then we're looking for it to go to the Senate early this week. The state laws will have to be adjusted at that point to cooperate with the new bill as well. But my understanding is that there is a timeline that everyone is trying urgently to meet. There are many other laws, and instead of going through many of these, what I can do is take the document that I gathered together in conjunction with the attorney that I partner with from an employment perspective, put that together and make it available as a resource on the Chamber's website so that people can go through it at their own and take out what pertains to them. There's a lot of other things we could talk about, but I think at this point that just touches generally high level from an HR and corporate perspective.
Thank you, Wendy. That was very helpful. And we will have a question and answer period at the end. But now it's my pleasure to introduce Dr. Philip Dulberger, EVP and Chief Physician Executive at Tidelands Health. And he's going to share some of his expertise with the business community now. Thank you.
Thank you, Karen. Thank you for having me this afternoon. Before I begin, I guess what I'd like to encourage all is to maintain calm. And what I spoke to our church yesterday, what I would encourage is take social media and media breaks and try to just take some time out. There is a lot of fanfare, as there should be. It's a pandemic, but we also need to understand that businesses and others we need to continue to care for our community and our staff, and we'll care for our patients and staff as well. So I guess what I'd like to do, if okay with you, Karen, is to start out with a little about the disease, what it is, how it got here, where we are, what local planning is going on, and then talk a little about what you as a business owner can do in your area.
That's perfect.
Okay. So first, this is what we call a coronavirus 19. It's the novel virus, which means it's new, and so we don't know a lot about all of this as a community of science. So what that means is it started, as we all know, in Wuhan, China, through some type of a animal to human spread, and then from there we know that you've seen all this on the maps about how it spread throughout the globe. What we don't know is we don't know if this will be like the flu type that we have in the past dealt with through flu vaccines, and if we'll have a seasonal diminish in this. We're all keeping our fingers crossed and hoping for that, but we don't know that. So with that, we need to continue to practice certain things that we can now have in our community. We have had some cases that have been documented, as you know, in South Carolina. So we're carefully tracking not only geographical travel, but as it comes to our community, and I think we're foolish to think it's not an if, it's just a when, and then how we deal with that. So we're making preparations at Tidelands Health. I'm working with others around the region, McLeod, Conway Medical Center, as is our full administration, Grand Strand, to make sure that we have regional planning for this. So as an employer and as an individual, what can you do? The first thing you can do, and that anyone can do, is good hand hygiene. So I have to compliment, when I came in, Andrea was wiping the doors and the handles off with some type of a viricide wipe. So that is the first thing we can do. And when I talk about hand hygiene, that's not just kind of the quick thing. It is literally what we would do is increase and do some type of a hand hygiene where you're getting your fingertips, get in between the fingers, get your thumbs, and get as high up on your wrist as you can, and do that for what they say 2 birthday songs, or about 20 seconds. Hand hygiene is the most important thing to reiterate that we can do. This disease is transmitted not aerosol to aerosol, meaning from me to you. It's through a respiratory droplet contagion. People ask, how long will that virion live on a fomite or an inanimate surface? There's many studies that show hours to even up to a day or two. The question is, we don't know how virulent that pathogen is after a day or two. But the good common sense would be hand hygiene, where you can wipe your surfaces down, maintain social distancing, meaning about 6 feet if you can. Use good cough etiquette. Don't cough into your hands, because what are we likely to do? Reach out and try to shake someone's hand. So cough into your elbow. As you noticed, Mark, when we greeted each other, we did a fist bump. I've been encouraging an elbow bump, and or others are saying foot, activity. But however you want to greet, I steer away from the foot. I don't need broken ankles because someone trips. But what I would suggest is, again, use common sense social distancing. Try to minimize large group gatherings. So to the extent, and the governor's already issued certain guidance on that as well. Thus the reason we've moved, and I apologize, I had gone to the Pine Lakes. My invite had not yet updated. But to the extent you can minimize and use virtual platforms to communicate to your staff, use that platform. The other piece is plan for illness. So don't wait till it happens, but plan for illness and call in. And when that happens, have a staffing backup plan. So those are really, to me, some of the most important things. The other is, and I know we talked about it from an HR standpoint, develop some type of travel guidelines. So you're going to have staff that want to travel. Have some mechanism to understand that travel, discourage and follow the CDC guideline. I would encourage you, any of you, please share with your staff CDC guideline web links that will give them updates. Zone 2 and Zone 3 areas are being updated frequently. As we all know, the president has issued a travel ban. So to the extent your staff would have to travel, I would encourage, most businesses at this point are canceling, obviously, where they can elective. If it's an emergent or a mission critical meeting, then you have to do what you have to do. If you can't move those to virtual. But any travel that is business related, most organizations are canceling that and trying to reschedule. But again, if your staff were to travel and then return, please I would encourage some return to work process where you can vet where they've been, what the risk to the organization is. Again, from a healthcare perspective, we're trying to worry about our healthcare personnel. There's only so many limited healthcare staff we have, so we're trying to maintain their health. I would encourage each business owner to do the same with theirs as well. Have contingency plans for when staff do call in sick. So,
Thank you.
I could go on, but I'll wait for some questions. I'm sure there's going to be quite a few clinical questions.
Thank you very much, Doctor.
Sure.
And now we're going to have Mark Kruea from the City of Myrtle Beach share the latest update from the city.
Thank you, Karen, very much. Glad to be here. Thank you for listening. We'll certainly entertain questions. The City of Myrtle Beach has been pushing out the health and safety protocols for a good 2 weeks now, both to our internal audiences and our external audiences. We have about 1,000 full-time staff members. They provide service in our community. We want to make sure that the people they serve are well protected, but also that our people are well protected. So we've been disinfecting, recommending the fist bumps and I think even the Jimmy Buffett shark fin thing. But take those precautions, continue to do that. That's one of the safest things that you can do. This is a challenging environment. It is changing daily. We've spent a good part of the last 3 days in meetings of one sort or another. I'm happy to say that I think we've worked out a new date for the PD Street Rodders car show. Hopefully that'll be out here very shortly and you'll be able to begin to reschedule that activity. That'll be in September, late September. The PD Street Rodders are coming back to us, I think. But want to make sure that you're doing the things that you need to do to communicate with your different audiences. We are encouraging regular communication with our staff and with our public through both internal messaging and then our social media and our website. So regular communication is good. The more frequently you can be in front of someone with the message that you want them to hear, that's the opportunity to do that right now. Overshare. I generally have a tendency to overshare information. As someone mentioned, let's be calm about this. We want calmness, not calamity, and information, not inflammation. So keep your resources and your information sources accurate and vital. The CDC and DHEC both have great pages if you're looking for a background of information. Use some common sense. Pretend that you're your customer. How would your customer want you as a business or as the City of Myrtle Beach to provide service? We are looking at some ways to do telecommuting, but I think our options there are fairly limited. City buildings are closed to the public at this point. We did that today, and we expect that will occur on a weekly basis. We are updating our information probably weekly. It's possible that we'll have interim updates. Since I've been following this today, the City of Miami has announced that it wants to cancel spring break. They're running people off the beach in Miami, believe it or not. The City of Charleston has decided to limit gatherings to 50 people or less and has imposed some restrictions on restaurants in terms of hours of operation for restaurants. We aren't there yet, and yet we've had those conversations, just as you've probably had those conversations in your community. But again, what would you want your customer to know? Make sure that you're sharing the information with them and your staff that you as a customer would want to hear. And follow others' leads. The information from Dr. Dulberger and Wendy have both been great. If there's good information out there, feel free to borrow it and share it with your folks. And as Dr. Dulberger said, everybody is stressed at this point. Make sure that you do take the opportunity to address the stress if it's necessary, to encourage people to take a deep breath and realize it will, I couldn't even take a deep breath, realize that it will calm down at some point. One of the challenges, I think maybe the biggest challenge with this event is that we don't know what its duration will be. We're taking it on a week-to-week basis, and surely in the back of everybody's mind is how sustainable is this new heightened level of awareness of drawing back. And 2 weeks, sure. If it's beyond that, we're going to be in a new reality. We will be in uncharted waters. We live in a coastal area. We're accustomed to hurricanes. I've begun to think of this as a health hurricane. So we're setting new standards and new protocols for this sort of activity. We talked a little bit about, Wendy McCrackin talked a little bit about leave policies. Try to be generous with your leave policies and your customer return policies. We have the convention center, our recreation centers, the other facilities that we would rent from the City of Myrtle Beach. We've been allowing the businesses, the organizers, to cancel their events, and we've been refunding their monies. And the reason for that is that messages send actions. You're used to seeing a message, whether it's printed, whether it's audio, whether it's video, but your actions also send a message, and we will be shaping the future of Myrtle Beach for the rest of this year, probably for the next couple of years, based on how we as a community respond to this issue. So think about what you're saying indirectly with the messages, the actions that you're sending to the community. And the when can be just as important as the what. When you respond to something, the timing of your response is almost as critical as the what in this particular case. Focus on the facts. We talked a little bit about that. Use, again, the Centers for Disease Control, their information with that. Know when to disconnect, check out when you need to. Communicate, have a plan, have a business continuity of operations plan. We're looking at that from the City of Myrtle Beach. We've got about 1,000 full-time folks. The police department is out there. They're realizing that, we can do some online reporting, but we still need to be present in the community. Our recreation centers, since they're closed, we've taken time today for our staff to do some deep cleaning. The City of Myrtle Beach is going to be cleaner than it ever has been, I suspect, when all of this is said and done. But have a plan. Know what you'll do if some of your key people end up being out because their family may be sick. We've had a couple of instances where one of our employees' spouses or family members has been in direct contact with one of the cases here in Horry County. Our employee hasn't been, but upon the advice of the CDC, that staff member is staying in quarantine for 14 days. So you need to know how to respond to that. And then go ahead and have some guidelines for your staff members. How will you greet? We talked about fist bumps and so forth. Pass that out to your staff members so that they know what sort of reaction to expect. Sanitation, supplies. Finding certain supplies has been difficult, but make sure that you have that. One business locally is calling it a sanitation station and encouraging people to ask for sanitation supplies if they need those. And then, of course, employee health. Stress that your staff members should not come to work if they are not feeling well. Again, having the information in advance, having these conversations before you get to the critical situation is good. So have a communications plan that will adapt to these changes. We've spent time again in meetings, and I expect that we'll do a regular update both to our staff and to the public through all of our sources. Be a trusted communications source. Make sure that what you're sharing with the public has validity and is not making the situation more extreme by sharing inaccurate information. And again, keep your message constant across all of your platforms. The City of Myrtle Beach is canceling meetings for this week or rescheduling meetings for this week. All of our neighborhood watch meetings for the rest of the month have been rescheduled. I think all but one of the events at the convention center for the rest of the month has been self-canceled by the promoters at this point. I think we're keeping a wedding at the train depot simply because we did not want to interrupt someone's wedding plans, but otherwise we're taking the precautions that we need to take to make sure that the public is safe, that our business community is safe, and that our staff members are safe as well. One last thought. This has been a fairly polarizing subject along the way, and you're walking a fine line into this new uncharted health hurricane territory. You've got the folks who think that the response has been extreme, and then the folks who think that the response has not been extreme enough. So I would recommend that you come down on the side of more caution rather than less caution until we have a better feel for what's going on.
Thank you, Mark. Appreciate that. Now I'd like to share with you just a few things that are happening here at your chamber and CVB. As you have heard from our three panelists, We are also in constant communication with our business community, our tourism attraction owners, our hoteliers, as well as our restaurateurs. Many are staying open, but they are taking all of the extra precautions that we've talked about today to spread want to make sure that we're preventing the spread of infection. Some are closed temporarily. We are posting all of the closings and cancellations as we learn about them on myrtlebeachareachamber.com as well as visitmyrtlebeach.com. So we urge you to go there and to, again, send other people who may be looking for valid, accurate information about what is open and what is not. And we are asking everyone, our residents as well as our visitors, to follow stringent health hygiene practices. And we just want to note that we do have visitors that are here. We have many visitors that come at the beginning of the winter season and they plan to stay for several months, and so they are still in market. Many of them are making plans to leave our area and to return home. Others are making a difficult personal decision as to whether they will stay or not. I think it's clear in our tourism industry, last week was a very, very disruptive week with many, many cancellations, particularly of our group business. So as Mark just alluded to, many of our sports events, which have become a real high watermark for us in our spring season, they had to cancel. They really did not have any choice in the matter, given that many of those organizations were dealing with students or they were dealing with travel bans that originated from their home state. So in many cases, what we heard were that these cancellations were most reluctant, that they really wanted to be here in the Myrtle Beach area, but for their own safety and the safety of those guests, we believe they made the right decision, as painful as that was. We have provided a one-page flyer for our hospitality partners. If you need this and have not seen this as a downloadable PDF, please reach out to us. Not only does it have a lot of great hygiene tips, but on the back it also has those really important phone numbers to be able to get in touch with DHEC, but to also to reach out to the CDC and onto the MUSC website to see if a screening needs to begin. So those are just a few of the things that we're doing. We are also posting daily updates on myrtlebeachareachamber.com/coronavirus, and we'll continue to do that as, again, those closures and those cancellations and other important pieces of information come forward. One of the things we're looking at right now is our dining industry with our restaurants. Many are making decisions about moving to options that allow our visitors and our local residents to still purchase food, but to do that more at a curbside pickup kind of situation, so they don't need to actually go into the establishment, but they can still avail themselves of a meal, which is great for our residents, but it's also great for our local businesses who certainly want to stay open and want to try to keep their business viable right now. So curbside is an option. We also have many people that are taking advantage of delivery, where people can call and they can order, and that meal could be delivered to them at their front door without any personal interaction, where they could simply text the recipient to say your meal is waiting at your front door. And then of course we have other restaurants that are deciding to stay open, at least for the time being, but they are limiting their hours, and they're also taking extraordinary lengths to comply with the governor's request to not have too many people in their establishment at any one time, inclusive of their staff as well as their guests. So we urge you to continue to go to our website and directly to those businesses' websites to get the most accurate information that you can there. At this point, we want to share with you some of the things that are going on with your chamber in terms of what we are doing. We have canceled all of our own events in consideration of the governor's request through the end of this month, so through March 31st, and we will continue to evaluate all those events that are currently posted in the month of April, thinking that many of them too will need to be canceled, but we will continue to check on that on a day-by-day basis. Right now, your chamber is maintaining essential personnel in our buildings, but we are moving to a majority of our team going to a telework situation and meeting through conference calls and video conference calls like what we're doing right now. We are working with limited staff in our visitor centers, both here at our Oak Street Center as well as at our airports, and we're taking extra precautions for safety. Our staff will no longer hand out visitor guides to visitors that are deplaning from NYR, and they're increasing the frequency in which they clean all counters and all services. If it becomes necessary to close those visitor centers temporarily, we are prepared to do so. So again, a full list of resources available for all businesses do exist at myrtlebeachareachamber.com, and we encourage you to go there. I would like to take a moment also, Wendy mentioned some of this, but our Government Affairs Director, Jimmy Gray, has been able to prepare a short update on what is going on legislatively as it relates to some of the things we've heard from the governor. So at the state level right now, the State House is not accepting any visitors or guests or lobbyists right now. And the House was previously scheduled to be on furlough, but they will be coming back this Thursday, March 19th, so they can take up urgent business related to the bills that we're all looking forward to. The Senate, the State Senate is expected to meet tomorrow, March 17th, and this is expected to be the only day that they will come in to meet this week. At 11 a.m. tomorrow, the Senate Finance Committee will be meeting to consider Governor McMaster's emergency public health response proposal. It's expected that the Senate Finance Committee will quickly approve that measure before it give a special preference to streamline passage out of the Senate Tuesday or Wednesday of this week. So then when the House comes on Thursday, they can take that up very quickly. The governor's proposal calls for an appropriation of $45 million for the Contingency Reserve Fund to DHEC for coordination of the state's public health response to the COVID-19 virus. And this $145 million will be taken out and deducted, if you will, from the $128 million one-time taxpayer credit that was previously passed by the House in its budget. On the federal legislative outlook side, we just want to let you know, as Wendy mentioned, on Saturday morning, the U.S. House passed the Families First Coronavirus Response Act by a vote of 360 to 40, and our own Congressman Tom Rice was in support of that bill. Right now, we are expecting the Senate to take up the bill later this week, and it is expected to pass. President Trump also supports this bill. A snapshot of what's proposed there, just so that you fully understand. $82 million would go to DOD to cover the costs of COVID-19 testing for military members and their families. $1 billion to the National Disaster Medical System for COVID-19 tests for those without health insurance. It also allows the USDA Secretary to issue waivers for state plans that increase costs to the federal government, specifically thinking about things like school lunches, which was covered extensively in the governor's press conference yesterday. It suspends work and work training requirements for SNAP during this situation, and as it relates to guaranteed family and medical leave, employees of employers with fewer than 500 employees and government employers have the right to take up to 12 weeks of job-protected leave under FMLA to be used to quarantine or take care of a family member or child. $1 billion for emergency grants to states for activities related to processing and paying unemployment benefits, half of which is reserved for emergency grants to states that see a 10% increase in unemployment. So again, these are just a couple of the steps that are being taken by our state and our federal legislature. If you'd like more information on all of this, you can go to appropriations.house.gov, and that will give you even more detailed information on that right now. So again, a lot happening. This is very fast moving, but we wanted to share with you what we know, and please feel comfortable reaching out to us via email or social media or by phone call and we will do our very best to answer questions. So speaking of answering questions, we are going to open this up to a Q&A time period now. We do have limited time for questions and answers, so if we don't get to your specific question today, we will post the answer on our website at myrtlebeachareachamber.com/coronavirus. So again, please submit to us any questions that you have at askus@visitmyrtlebeach.com, and we will do our very best to get those answers back out to everyone in the business community. And again, we appreciate our panelists being willing to share other information that they have access to and they've referenced today, so that you have the most complete information available as of today, and then as that updates, and as of tomorrow, and so forth, as we go through this event. Since none of us really know what the end date for this will be, we need to stick together, and we need to continue to work together and communicate accurate information to each other so we can make the very best business decisions. At this point, I think we're going to open it up to any questions that we may have already received. I'll receive that question, and then if it's for Wendy or for Mark or for Dr. Dulberger, I will pass that on to them to do their very best to answer that question.
If a retail company or hotel have an employee with COVID-19, what is the protocol?
So if a retail company or a hotel has an employee with COVID-19, what is the protocol and who should they be communicating that information to? I think I would like to turn it over to Dr. Dulberger.
Well, thank you. If you have someone who is COVID or COVID concern risk, someone who is what we'll call an influenza-like illness, I would once again try to underscore the importance of encouraging that employee first and foremost preventatively to self-quarantine. So if you have an individual that is COVID-19 positive, is that what the question is what I'm understanding, and they've been identified as positive and been in the workforce with others?
What I read is what they
Okay,
gave
I
us.
just want to make sure I understand the question. So if you have someone, then what you would like to do is go and identify those individuals that have been in close contact, and out of an abundance of caution, our job as a community is to help contain this, right? So in the abundance of caution, I would encourage, to the extent the business is able, to then put those folks that have been in close contact on some type of a leave, at least a self-quarantine, and monitor those for symptoms. Symptoms are identified. 88% of these patients that have had COVID-19 have a fever. So that is one of the early symptoms, coupled with the influenza-like illness. The other option is to make sure that you have contact with your provider as needed, either through a telehealth platform. Tidelands Health is working with MUSC, and we also have plan to have some access for telehealth platforms. I would encourage anyone who is going to a provider, whether it's their physician or the emergency department, please call ahead. Because if you're coming with symptoms, we need to be able to identify and work you through safely, but also at the protection of the others that are there. So call ahead to your emergency department or your primary care doctor. But if you have a patient, if you have an employee who has been identified as COVID-19 positive, then out of an abundance of caution, I would identify those that have been in close contact and encourage them, to the extent you're able to allow that person to work from home, make contingent plans, or self-quarantine.
Thank you. Sir, Wendy, what would you like to add?
The one thing that I would add from our perspective is that we are supposed to contact state and local departments to just make sure that we're following the right course of action as well.
Thank you. Another question?
There's a question asking if we know, related to that House bill, if independent contractors are covered under that bill. If we don't know, we can follow up later.
We are looking at that information right now. So let us take that, and we will provide an answer as soon as we double check to make sure that we give the accurate information on the question about whether the House bill that is being taken up right now applies to subcontractors as well as employees of a company. Another question?
Apart from social distancing and proper hygiene, what recommendations are being made regarding business closures for businesses that cannot maintain appropriate customer distances, such as amusement parks?
So again, the question is about social distancing. How can that be accomplished if you operate or are a business leader managing a business that by its very nature makes it almost impossible to create a social distancing situation, such as an amusement park or such. But that was the specific question asked.
And the information on this is changing almost hourly. I believe President Trump has been making an announcement while we've been here talking, lowering the threshold for how many people to be in a group at one point in time. I think it started out at 250 or so a week or two ago. It's down to about 50 now, and I think today's number may be 10 by the time it's all said and done. But keep that in mind. I think I would stress, and maybe the doctor here will confirm this, that the best response is to keep yourself healthy. So it's up to the individual to say, I'm comfortable doing this or I'm not comfortable doing that. You follow the protocols, don't put yourself in what you would consider to be a risky situation is really the first step from a business owner's and operator's standpoint. Think about how your staff members will react, what the latest policies and guidelines are. And again, that's a moving target literally daily. But stay up to date on that and respond as you would expect that your customers would want you to respond. This is a chance to show a positive outcome by the way you respond to this issue.
Thank you. The next question?
Coming off of what you just said, Mark, we're getting a lot of questions about restrictions on restaurant closures or restricted hours. And for people who are coming from out of town, such as North Carolina, where should they be looking for that information?
We've fielded a fair number of those questions via social media and just plain old phone calls here in the last couple of days. At this point, we don't have any imposed restrictions on restaurants' business hours. It is something that we've talked about. It's not something that we're ready to implement as of today. I think it's, again, let's see where we go at this point, but I don't know that any of that's been ruled out. Charleston has imposed some hour restrictions on restaurants and some numbers in terms of how many people can gather. Again, it's been a moving target, so pay attention to the latest information. Right now, our businesses are open, subject to their own discretion. I don't anticipate that we would say businesses can't open. I'm not sure that's a sustainable model, but keep your ear out and see where things go at this point. We'll have updates on a regular basis, surely daily with our own staff, daily through our social media if anything changes, and then probably on every 3 or 4 day or at least once a week cycle.
And as I mentioned earlier, again, we are hearing a lot at the Chamber about businesses making decisions as recently as today about changing their methodology, if you will, in terms of how they deliver meals. They don't want to close, they want to keep their staff employed. They have stock, they have supplies, but obviously they want to be protecting their staff first and foremost. They want to be preparing that food in a highly hygienic way, but then they do like the idea of having an ability to still be able to serve the public. That may turn more and more to, again, a curbside pickup kind of arrangement, or may use delivery options like Dash and other things like that, where a customer can call and arrange to have that meal brought to their home without having to actually go into the restaurant. And so again, we're just asking our restaurant industry to take a look at all those options and make the best decision for their particular circumstances for their company. Again, keeping their staff health in mind as well as their guests' health. Other questions?
So how long does the virus last once you get it, and how is it treated at this time?
We'll turn that over to the doctor.
That is a great question. The question is, how long does the virus last and how is it treated at this time? So first of all, the virus will last pending your state as an individual. Some younger are less affected by this. The bigger and higher risk populations are your elderly. And I would encourage us to understand that when we see mortality numbers on this, that the mortality numbers depend on the denominator. There's a numerator over a denominator. Because we don't know all of the people that may have been infected with this, then as that number grows, the mortality rate may actually come down pending what we didn't know is how broad the spread was. But right now there is no known treatment for this, so there's a lot of desire for people to get tested. I would tell you right now, asymptomatic testing has not yielded any positive, so I would again encourage us to remain calm. And there is supply chain interruptions going on across the U.S. for all health systems and businesses, so our ability to replenish some of these needed reagents and media to perform these tests will continue to be a concern. So we're attempting to prioritize and triage those so that we don't have large-scale turnout for someone asking for a test who is otherwise healthy and well. Again, asymptomatic individuals, at least of the current literature, have not been shown to turn out to be positive as of yet. As far as the disease itself, again, it will depend upon your underlying health status. If you're healthier, just like the flu, it may last longer in some individuals versus shorter in different individuals. So again, out of an abundance of caution, if you're immunocompromised, if you're elderly, those are the more susceptible patients, and I would encourage you to maintain and self-quarantine, stay away from large areas. Anyone who has influenza-like illness, the best thing we can do is to self-quarantine and stay out, and then try to go back in time and identify folks that we've been in contact with and encourage them to say, I've now come across these influenza-like illness and I'm going to self-quarantine. I want you to be aware. And as a business owner, again, out of an abundance of caution, allowing those folks to stay home and not infect the rest of your workforce. But again, there is no known treatment as of yet, number one. Number two, the disease longevity will last pending the underlying status of that individual and how they would fight a typical type flu or other type of pathogen. So it's not a certain period of time, it's your typical flu type symptoms.
I believe we have one last question. Should local businesses discourage travel of their employees out of our area?
Should local businesses discourage travel out of the area? I know I have a perspective on that. I'd love to hear Mark and Dr. Dulberger's.
We've asked our city staff members, well, we haven't asked, we've told our city staff members that we will not support travel at this time. We attend conferences and other things, and for business travel, we're not going to support at this time. We can't tell them not to take a vacation if they've got a vacation planned, but from a business standpoint, we'd like to limit that sort of travel, just keep the number of contacts, the number of exposures down. Again, that's going to be an individual choice within each business.
Yeah, I would agree with Mark, and I'd like to hear Wendy's HR perspective on this. But again, discourage travel from a business perspective, that's what the best practices we're seeing across the country are. As far as an individual organization, I would encourage everyone to have some form of a travel policy, because you need to monitor folks that are traveling away and then returning to the workforce that could potentially then be a vector back to the rest of your staff. So we, as Tidelands, we are looking at that and implementing some type of a travel, at least monitoring policy and a return to work enforcement. Again, not once they return to work, show up and tell us that, but understand where they're going. Again, the CDC website is a great location, as is the DHEC around Zone 2, Zone 3 travel. That's going to become less and less relevant, obviously, as this spreads to the states and gets more spread. But again, knowing where your staff is going, and then when they come back to work, would highly encourage the idea they call ahead and then debrief on what their symptoms are before they return to work.
And that would be true, I think, for vacation, for recreational travel, not just business travel, particularly for recreational travel.
And we are looking at that for personal travel. The business travel, to the extent we can curb that, we have. I would encourage anyone, as Mark said, this is around personal travel as well. If they're traveling to a wedding that has 100 people at a gathering, and those people then are from different geography, that of course puts that individual at risk to bring that back to your workforce.
That's exactly how HTC is treating it. We cannot legally tell an employee that they cannot take a vacation and go somewhere. What we can control is their ability to come back into the workforce. So we are asking for disclosure of where they have been and using the CDC guidelines accordingly to screen them.
And the Chamber of Commerce has followed that exact same practice. We had a number of people in our sales force, not surprisingly, who have traveled over the last 2 weeks. We have asked them to move to a telework situation, so they're voluntarily working from home to protect themselves, but also to protect fellow coworkers. And we do have a few people this week who are planning vacation, and our policy has been to understand where they are vacationing in the U.S. or going to visit family members, and making it clear that when they return back to the Myrtle Beach area, they need to, again, return home and then be in contact with the chamber and not return back into the workforce, just to have an abundance of caution right now. I believe that, again, we need to lead the way, all of us on this call as business leaders, as people in this community. We need to model the kind of behavior that we want our employees to undertake. And so, again, that may be disappointing for some people that wanted to go to a certain conference, or some people who had planned a vacation and now are rethinking that. They'll have other opportunities, but we feel like this is the best way to protect them and to protect our workforce and everyone else in the community. So that's the policy that we have undertaken here at the Chamber. And I think that concludes our questions. If you have additional questions, again, you can email us at askus@visitmyrtlebeach.com, and we will look at those questions, and we'll reach out to our panelists and to other experts who can give us answers to your questions and get that information back to you. And we appreciate very much your time today. Again, thank you for the forbearance and the patience that everyone has shown during this very difficult time. It is truly uncharted territory. We're all learning together what to do, how to behave, how to work together through this so that our community will come out stronger. And again, we appreciate all of your energy, all of your effort. We know this is a trying time, and we stand ready to continue to support you however we can.
Okay.
So thank you.
Can I add one?
Yes.
Again, I would just encourage calm. I think what you're seeing is a significant angst building in social media and across the United States. Maintain calm. As you said, it's up to us as leaders to lead this way. And I think Mark brought it up. This is a time where communication, I think you've heard across all four of us, is the most important. So passing along the facts and having either team huddles, making sure you follow chain of command for information that's released as a business, because we can have individuals make ideas, share that, and then that may end up creating a new workflow that then you find yourself spending time bringing that back and trying to go back to what you had originally planned on. So communication and calm, and from a standpoint, remember good hand hygiene, social distancing, call ahead if you're going to show up to a healthcare professional.
Thank you. Any final remarks, Wendy?
No, I appreciate the opportunity to be here today.
Thank you, Mark.
From a business standpoint, since our offices are closed, we're making workaround arrangements through the website, through telephones, through other mechanisms. The construction industry is still very actively locally. We've got a drop box for building permit requests at the city services building. So we are accommodating the need to continue operations as usual to the extent that we can by limiting the interpersonal contact that we have. So if you've got a question, shoot us an email, give us a call, send us a DM on Facebook. We'll be glad to answer that. But we do have ways to pay utility bills online, by telephone. We can handle all of the construction permitting that I think exists currently out there. Those services that don't involve a lot of interpersonal contact are continuing as usual. Our solid waste service is on its regular schedule this week. And again, we'll provide regular updates. That regular communication really is the key to keeping people informed so that they're not suffering an information deficit and wondering what the next step may be.
Thank you again. We appreciate your time today.